A 6-year-old female Cocker Spaniel came into the clinic by her owner for vaccinations and a checkup because, according to the owner, she'd been lethargic and urinating more frequently. Upon the physical examination, her temperature was 103.4, her mucous membranes were pink, her CRT was 2 seconds, but Dr. Plants revealed dehydration, an enlarged uterus from palpation, and some discharge. So we ran laboratory tests, a full panel, CBC, chemistry, T4, and 4DX tests. The laboratory results showed low monocytes and high eosinophils, suggesting an infection. The chemistry was within normal ranges, but the T4 showed hyperthyroidism, and her Lyme test was positive. So based on the elevated eosinophils, uterine enlargement, elevated temperature, the increased urination, and the discharge, Dr. Plants diagnosed this dog with a pyometra infecting the abdomen and Lyme disease. For treatment, he recommended an invariohysterectomy, which the owner agreed to, so she was hospitalized and put on immediate IV fluids. She was treated with ampicillin, banamine, and an anti-inflammatory and thyroxine for her hyperthyroidism. The next day, she was given atropine, ACE, and xylazine and Ketoset for anesthesia. While she was under anesthesia, she got diazepam to halt seizure activity, and then Dr. Plants performed his surgery. Over the next 2 days, her treatment plan was continued, and her temperature began to slowly decrease. By the third day, her temperature was 101.1, and she was discharged and scheduled for a recheck the following week. On her recheck, she had a fever of 105 degrees, so she was hospitalized again, and this time her blood work showed very high white blood cells, so Dr. Plants put her back on ampicillin, Baytril, banamine, and thyroxine. 3 days later, the fever was gone, she had a normal blood work, and she was able to be discharged, but had a recheck the following week for her suture removal.